This is Hazel, a student nurse. In this video, I'm going to demonstrate how to perform a neurologic system assessment. Now, before you do a neurologic system assessment, you'll want to provide privacy for the patient. Do your hand hygiene and explain to the patient what you'll be doing. And you'll want to gather your equipment. In general, you will need your examination gloves. For the cranial nerve examination, you will need your pen light, your Snellen chart, sterile cotton ball, substances to smell or taste, such as soap, coffee, or sugar, and tongue depressor. For the sensor examination, you will need cotton ball, objects to feel such as key, paper clip, test tubes containing hot and cold water, or if you don't have test tubes, you can use cups, and the tuning fork. If you don't have tuning fork, you can improvise, just like what I have here. I'm just gonna use this fork as my tuning fork. And for reflex examination, you will need a reflex hammer. And I only have an improvised reflex hammer here. I'm just gonna use our hammer. This will gonna be the pointy one, and this will gonna be the flat one. So let's get started. Good morning, I'm Hazel, your student nurse. How are you today?
I'm doing good, thank you.
That's great to know. May I have your name and date of birth, please?
I am Jamie Lynn Bicaco, born on December 14, 2003.
Okay, before we start the examination, I'll just have to ask you some questions. Do you experience headaches, any numbness or tingling?
No.
Do you experience seizures?
No.
Do you experience dizziness or lightheadedness or problems with balance or coordination?
No.
Have you noticed a decrease in your ability to smell or taste?
No.
Have you experienced any hearing in your ears or hearing loss?
No.
Have you noticed any change in your vision?
No.
Do you have difficulty understanding when people are talking to you?
No.
Do you have difficulty making others understand?
No.
Do you have difficulty forming words or comprehending and expressing your thoughts?
No.
Okay, do you experience difficulty swallowing?
No.
Have you lost bowel or bladder control, or do you retain urine?
No.
Do you experience any memory loss?
No.
Do you experience any repetitive, involuntary trembling, quivering, shaking, or other movements or tremors?
No.
Okay, have you ever had any type of head injury with or without loss of consciousness?
No.
Have you ever had meningitis, encephalitis, injury to the spinal cord, or a stroke?
No.
Do you have a family history of high blood pressure, stroke, Alzheimer's disease, dementia, epilepsy, brain cancer, or Huntington chorea?
None.
Okay, do you take any prescription or non-prescription medications?
No.
Do you smoke?
No.
Do you wear your seatbelt when riding in vehicles? Do you wear protective headgear when riding a bicycle or playing sports?
Yes.
Alright, can you describe to me your usual daily 24-hour diet recall?
I only drink coffee in the morning, curry and rice for lunch as well as for dinner.
Have you ever had prolonged exposure to lead, insecticides, pollutants, or other chemicals?
No.
Do you frequently lift heavy objects or perform repetitive motions?
No.
Can you perform your normal, independent activities of daily living?
Yes.
Alright, let's proceed now to the examination. But before we do that, I would like to ask you to remove all your clothing as well as your jewelry and put on this examination gown. Initially, I will have you to sit comfortably on the examination table or bed, but expect that there will be several different position changes through the different parts of the examination. I'll make sure that I will explain to you each position before the start of the particular examination. I also want you to know that this examination will take a considerable amount of time to perform and that I will provide rest periods as needed. There will also some actions that I need you to perform, such as counting backward or hopping on one foot. It may seem unusual, but those activities are part of comprehensive neurologic examination. Is that okay with you?
Okay.
So I'll start by just talking to you, and I'm doing what you call a mental status assessment. So I'm first often noticing your behavior. You're awake and alert and cooperative and responding well. And then I'm also noticing your cognition. So I'm gonna ask you some kind of silly questions. So can you tell me what month it is?
May.
Okay, that's correct. Can you tell me your favorite food?
Burger.
Okay, can you tell me who's the current president?
Bongbong Marcos.
That's right. Marcos is the current president. And can you tell me who am I?
Yes, you're my nurse today, and your name is Hazel.
Okay, so she is oriented to person, place, and time. And tell me why you're here today.
Well, I'm here today to be assessed of, and we're doing videos for the assessment of neurologic system.
Okay, she is also aware of the situation. And I also noticed that her dress is appropriate, his facial expression is all appropriate for the situation. I also need to screen her for depression and suicidal thoughts. This is a screening that's done at every healthcare because suicide causes a high rate of death. So, ma'am, have you ever been so blue that you felt like hurting yourself?
No.
Have you felt depressed or unhappy lately?
No, I'm having fun with my life.
Okay, alright. So, at that point, I can stop my assessment. If she answered yes to any of those questions, I would probe further with more questions about that. Alright, we're gonna move on now for the cranial nerves. And we're going to test the olfactory cranial nerve 1, the sense of smell. So what I'm gonna have you do, ma'am, is I'm gonna have you close your eyes and I'm gonna put something in front of your nose and have to breathe in and smell. And you tell me what you smell. And whenever you do this, use something that's pleasant smelling, not something that's really stinky because it could elicit like a gag reflex or something like that if the person has a sensitive nose. Okay. Coffee. And that's correct. So that cranial nerve is intact. To test cranial nerves though, you're gonna be doing two tests. Number one, you're gonna look at the confrontation visual field and you're gonna be looking at your peripheral vision. And then number two, you'll be looking at visual acuity using a Snellen chart to assess that. First, we're gonna test the peripheral vision by doing the confrontation visual field test. And to do that, you're gonna have the client stand in front of you about arm's length away. So what I want you to do is I'm gonna have you cover your right eye and I'm also gonna have to cover my left eye. So what I want you to do, ma'am, is to look at my eye and don't look at my finger, okay? And I'll just have you to tell me how many fingers you see. And you're gonna do this in the upper and lower visual fields, and you can also do that about the middle of the visual fields. So here we go.
2, 4.
Okay, correct. We'll go to the opposite. Again, stare at my eye and don't look at my fingers.
1, 3.
Okay, good job. Now I'm gonna test the visual acuity using the Snellen chart. To do that, I need you to stand 20 feet away from the chart. Look at the chart over there and I need you to try to read the lowest line that you can read. And first, you're gonna cover your right eye and then your left eye and then we'll do both eyes. Okay, cover your right eye. And what can you read?
8, DEFPOTEC.
Okay, very good. Now you're gonna have to cover up your left eye and do the same thing. Again, whatever line you can read, let me know.
8, DEFPOTEC.
Okay, now read both eyes and what line?
8, DEFPOTEC.
So she read from line 8, that means she has 20/20 vision. And this means that she can see the same line of letters at 20 feet that a person with normal vision can see. And we're gonna be looking at cranial nerve 3, which is ocular motor, 4, trochlear, and 6, which is abducens. And we're gonna do several tests to check for their function. The first one what we're gonna do is we're gonna be looking for any involuntary shaking of the eyes called nystagmus. To do that, we're gonna take our pen light. We're gonna hold it about 12 to 14 inches away from the patient's nose. And then what I want you to do is keep your head still. Don't move your head and just use your eyes to watch where I move the pen light. And as you're doing this, you're gonna perform it in the 6 cardinal fields of gaze. And you're just gonna move it. And we're looking for any involuntary shaking of the eyes. So here we go. Next, we're gonna see how reactive the pupils are to light. And to do that, we're gonna dim the lights a little bit and we're gonna have the patient stare off at a distant object. That helps dilate those pupils. And then we're gonna shine using our pen light at the side and we're gonna see how the pupil responds. It should constrict and then on the other side, it should constrict as well. Say that their baseline pupil size was like 3 millimeters. It should go down to 1 millimeter and it should happen on both sides. Okay, so stare off at that object rad on the wall over there for me. And that dilates the pupils. And we're just going to shine the light at this side. Okay, it constricts. Then go over to the other side. Do the same again. And they both constricted and equal size. Next, what we're gonna do is we're gonna check for accommodation. And how we do that is we turn the lights back on. We just previously had them dim, but we now make it light again. We're gonna have her stare off at a distant object that helps dilate the pupils. And we're gonna take a pen light. And you're just gonna slowly move it inward to the nose. And what you're looking for is that those pupils constrict. They accommodate. And the eyes close while looking at the pen light. So here we go. Stare off in the distance, please, and I don't want you to move your head or anything. Just keep it real still. And just follow this pen light, okay? Ready. Okay, so now we can document because we just checked all of the things with the eyes. We can document that the pupils are equal, round, reactive to light, and accommodate to distance. So that's where the acronym PERRLA comes into play. We're gonna go ahead and test cranial nerve 5, which is the trigeminal nerve. And this nerve is responsible for many things like mastication. So what I want you to do, ma'am, is I want to have you clench your teeth, like bite down for me. And I'm going to feel the masseter muscle, which is right here. This should be a nice firm ball. And then feel the temporal muscle. Now what I'm gonna do to also test that nerve, have her try to open her mouth against resistance. So try to do that for me. Okay, and she can do that. And test cranial nerve 7, which is the facial nerve. So can you close your eyes tightly for me and open them up? Okay, now smile for me. Frown. Puff out your cheeks. Okay, and she did that with ease, so that cranial nerve is intact. We're gonna test cranial nerve 8, which is the vestibulocochlear nerve. And what I'm gonna do is I'm gonna plug one of his ears and then whisper 2-syllable words. And we're gonna do the same on the other side. She needs to tell me what I said, so you ready?
Yes.
Okay, and I'm gonna clog this one.
Coffee.
Okay, very good.
Ocean.
Okay, and that nerve is intact. And we're gonna test cranial nerve 9, the glossopharyngeal. And so what I'm gonna do is I'm gonna have you, ma'am, say ah. And what we want is that uvula to move up. So say ah.
Ah.
Okay, and then we're just gonna test the gag reflex. I'm sort of just gonna poke a little bit back there and elicit a gag reflex. Okay, there you go. And cranial nerve 10. The vagus is intact because she's able to talk. She talked to me without hoarseness and she's able to swallow. Then what we're gonna do is we're gonna test cranial nerve 11, which is the accessory nerve. So what I'm gonna have you do, ma'am, is move your head side to side, up and down. Okay, and then try to shrug against my resistance. And she does that with ease. So that nerve is intact. Let's test cranial nerve 12, which is the hypoglossal nerve. And what I'm gonna have you do is I'm gonna have you stick out your tongue and move it side to side. Okay, and she does that with ease. Now I'll move on to your motor and cerebellar systems. The first thing I'm gonna do is to assess your condition and movement of the muscles. I'm gonna check your muscle strength, so we'll start with the upper extremities. Can you please hold your hands out like this? When we would do that for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then can you squeeze my fingers, please? Squeeze as hard as you can. Alright, good. Okay, so the reason that we check strength in this manner for a neurological assessment is that this arm lift is part of the NIH stroke scale that's used across the nation for the assessment of stroke. And doing the finger squeeze is an easy way to check assessment of strength of the upper extremities. And then for the lower extremities, I'll have you to lay back for a minute. And I want you to lift this leg up of the bed. And we do that for a count of 5. 1, 2, 3, 4, 5. Good. And then lift the other foot to a count of 5 as well. 1, 2, 3, 4, 5. And then relax. Again, that is part of the NIH stroke scale. That's why we use that method. And then if you can press down against my hands, and then pull up against my hands, that also tells strength of the lower extremities. Okay, so now we're going to do some tests of your coordination. Can you sit up straight, please? To do that, I'm gonna have you to touch each of your finger as quickly as you can. And do with the other hand as well. Alright, good. And now touch your nose and then touch my finger both as quickly as you can. Alright, that's good. Now we're going to check coordination of the lower extremities. So can you take your shin, just run it down on your shin. And then do it also to the other side, just run it right straight down. Alright, and then can you stand up for a moment, and I'm going to assess your gait and balance. To do that, I'm gonna have you to walk like a couple steps over there, just like about 3 or 4 steps. And then come back and walk heel to toe like this. Okay, good job. Your gait is steady. And now I'm going to have you perform the Romberg test. I'm gonna have you put your feet together, stand up straight, and put your hands at your side, and then close your eyes. And we would count 20 seconds, and you should be able to maintain the standing straight without falling over. Make sure you stand near the client to prevent a fall in case the client loses balance. Okay, you can open your eyes so the client's balance and coordinations are intact. So now we're gonna move on to check the sensory system. You can sit back again. I'm going to assess the client's light touch, pain, and temperature sensation. I'm gonna have you, mom, to close your eyes. And to test for the light touch, I'm gonna use a wisp of cotton to touch the client. And I want you, mom, to say yes when you feel it.
Yes, 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 yes.
Okay, good. The test for the pain, I'm gonna check your sharp, dull discrimination by using this paper clip. Then you're going to tell me whether you feel sharp or dull.
Sharp, 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 dull, sharp, dull, dull, sharp, 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 dull, dull, sharp, dull, 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 sharp, sharp.
Alright, good. Last thing to test is for the temperature sensation. Eyes closed and hold out your hand and tell me what you feel.
It's hot. It's cold.
Okay, good. You can now open your eyes. Now we're gonna test for the vibratory sensation. To do this, I'm gonna strike a low pitch tuning fork on the heel of my hand and hold the base on the distal radius of the client. Can you tell me what you feel?
I can feel the vibration.
Okay, in the forefinger tip. What can you feel?
Vibrating.
Alright. In the medial malleolus.
Vibrating as well.
And lastly, on the tip of the greater toe. What do you feel?
It's vibrating also.
Alright. The client correctly identifies the sensation. Now we're going to test your sensitivity to position. I'm gonna have you close your eyes and you tell me the directions it is moved, okay?
Up. Down.
Alright. The client correctly identifies the movement. Now I'll be testing the tactile discrimination, and again I need you to close your eyes and open your hand for me and hold this. Can you identify to me what object is this?
A key.
Okay, that's right. On the other hand.
Paper clip.
Okay, good. So the client correctly identifies the object. Now we're moving to testing our reflexes. I'm gonna start the test with the deep tendon reflexes. In your biceps first, I'm gonna have you partially bend your arms at the elbow with your palm up. I need you to relax your arm here for this to work, okay? I'm gonna place my thumb over the biceps tendon and I'm holding pressure on it firmly, and I'm gonna use the pointy part of the reflex hammer, and you have to give it a good whack. So I could feel the tendon moving and I see your finger moved. So that's good. And we're just gonna do the same thing to the other side. Alright, next I'm gonna assess the brachioradialis reflex. I'm gonna have you flex your elbow with your palm down. I'm gonna use the flat side of the reflex hammer to tap the tendon at the radius about 2 inches above the wrist. Alright, good. And then repeat on the other side. Then I'm gonna test the triceps reflex. To do this, I need you to stand up and I'm gonna have you hang your arm freely while I support it with my non-dominant hand. With the elbow flex, I'm gonna use the flat side of the reflex hammer to tap the tendon above the olecranon process. So the elbow extends and muscle contracts, so that's good. Then I'll repeat to the other side. Okay. Next, I'm going to assess the patellar reflex. I need you to sit here and I'm gonna have you let both of your legs hang freely. And I'm gonna use the flat side of the reflex hammer and I'm gonna tap the patellar tendon, which is located just below the patella. Alright, good. Then I'm gonna repeat on the other side. Okay. Last one for the deep tendon reflexes is the ankle clonus. To do that, I'm gonna place my one hand under the client's knee to support the leg. Then I'm gonna briefly dorsiflex the foot towards the client's head. Okay, good. No rapid contractions elicited on the ankle. Then I'm gonna do the same thing to the other side. Okay, good. Now I'll be testing the superficial reflexes and I'm gonna start with plantar reflex. To do that, I'm gonna use the end of my fork to elicit superficial reflexes, whose receptors are in the skin rather than the muscles. So with the end of the fork, I'm gonna stroke the lateral aspect of the sole from the heel to the ball of the foot, and I'm looking for the flexion of toes to occur. Okay, good. And then I'm gonna do to the other side. Alright. Lastly, for assessing the reflexes, if you suspect that the client has meningeal irritation or inflammation from infection or subarachnoid hemorrhage, we're gonna assess the client's neck mobility. To do that, first make sure that there is no injury to the cervical vertebrae or cervical cord. Then with the client in the supine position, you're gonna place your hands behind the client's head and flex the neck forward until the chin touches the chest if possible. So the client can easily bend head and neck forward, so that's normal. Then we'll test for Brzezinski sign. As I flex the neck, you have to watch the hips and knees in reaction to your maneuver. And her hips and knees remain relaxed and motionless, so that's good. She's negative from Brzezinski sign. And to test for Koenig sign, you have to flex the client's leg at both the hip and the knee. Then slowly straighten the knee. Did you feel any pain?
No.
Okay, that's good. No pain is felt, so that means she is negative from Koenig sign. So that concludes the assessment of the neurologic system. I already asked my client to change into her clothes. Now I'll perform proper hand hygiene, and also if there are any signs of abnormalities, we want to refer them to other healthcare provider for further evaluation. And don't forget to document all the findings to the client's record. After that, we are now done for the assessment.